Where does atrophy start in the brain for different types of dementia? Have you ever wondered where brain atrophy begins for various types of dementia? Understanding this is vital for diagnosis and treatment. Brain atrophy refers to the loss of neurons and their connections, and it starts in different regions depending on the type of dementia. In Alzheimer's disease, atrophy typically begins in the medial temporal lobe, especially in the hippocampus. This area is crucial for memory formation, and early damage here leads to memory loss, a key symptom of the disease. As Alzheimer's progresses, atrophy spreads to the parietal lobes and other areas, resulting in broader cognitive decline. The disease starts with the buildup of amyloid beta and tau proteins, which contribute to neuron loss. Frontotemporal dementia has a different starting point. Here, atrophy often begins in the frontal and temporal lobes. The specific area affected depends on the subtype of frontotemporal dementia. For example, the behavioral variant usually shows early frontal lobe atrophy, impacting personality and executive function. In contrast, language variants primarily affect the temporal lobe, leading to challenges with speech and language. Lewy body dementia starts in the occipital lobes and parietal regions, which may explain early visual hallucinations and difficulties with spatial awareness. Atrophy in this type of dementia is more diffuse, and subcortical structures may also be involved early on. Vascular dementia presents a variable pattern of atrophy. It depends on the location and extent of vascular injury. Atrophy may be patchy and involve subcortical white matter or cortical areas affected by strokes. Unlike other types of dementia, this atrophy is secondary to disruptions in blood flow. In rare genetic dementias, such as adult-onset leukoencephalopathy, atrophy can start in white matter regions. These conditions may involve microglial dysfunction, and recent advances suggest that addressing this dysfunction might stabilize disease progression. Atypical Parkinsonian syndromes with dementia, like progressive supranuclear palsy, show atrophy in specific subcortical and cortical regions. These include the basal ganglia and thalamus, which correlate with unique motor and cognitive symptoms. In summary, the starting point of brain atrophy varies by dementia type. In Alzheimer's disease, it begins in the medial temporal lobe. Frontotemporal dementia starts in the frontal or temporal lobes. Lewy body dementia often begins in the occipital and parietal lobes. Vascular dementia varies based on vascular injury sites. Rare genetic dementias may start in white matter, while atypical Parkinsonian dementias show atrophy in the basal ganglia and thalamus. Recognizing these patterns is essential for effective diagnosis and management. Early detection through imaging and biomarker analysis plays a crucial role in intervention and care planning.